Generally, patients who feel their lives are not in control, who feel depressed, who feel stressed, who feel that their identities are not what they want them to be, and yet feel unable to control what's going on in their lives. For example, overweight patients who just feel like no matter what I do, I can't lose the weight, and somehow cross that line from just overeating to binging. Those are the usual types. There are always exceptions, of course, and again, we don't know what causes some people to have binge eating disorders. We don't know what actually causes people to be overweight, although we're getting much closer to that. And it may turn out that in addition to psychological factors, there are biologic factors in the brain and in the body that cause people to gain weight. And when they gain weight, their self-esteem may go down. And when their self-esteem goes down, their coping skills may be affected, and they may then cross that line into binge eating disorder or other types of eating disorders. It's a very complex situation. We still haven't learned exactly what needs to be done. And let me digress just a minute. Even with people who are just overweight, who have this bariatric surgery, whether it's a stomach stapling or whatever procedure they have, we've seen patients who continue to be overweight and continue to eat in inappropriate ways, even though they've had the procedures done. And one wonders, well, why would that be? Well, it's because there's a psychological factor as well. I remember I gave a talk one time to a group of patients who had weight loss surgery, and they jokingly talked to me about how to beat the system. Well, you can't eat large amounts of food anymore because your stomach can't hold it. But you can eat ice cream. I mean, that goes through. You can eat chocolates. You can eat this, that, or the other. And I wondered to myself, gosh, these people have spent tens of thousands of dollars and gone through this surgical procedure only to learn how to, quote unquote, beat the system. What drives that? And the driver is the psychological factors we've talked about. Control issues, self-esteem issues, stress, depression issues, which are common to patients with eating disorders.